in New York. Welcome everyone on behalf of the Humanitarian Office. Glad to have you here today. This is the Humanitarian Office hosted 16 Days of Activism 2021 event. And I really want to frame this event as a learning event. It is not a high-level event with a First Lady coming to speak. It's just really so that we can learn as we go into the next strategic plan. First slide, Marita. We're talking about gender transformative approaches, in GBV. Oh, just go back one to the intro. There we go. So today we're going to focus on gender transformative approaches in GBV programming and coordination. I want to say that we're happy to have speakers from 3 regions here. And we have a speaker from Arab states, from West and Central Africa, representing Niger, and 2 speakers from Asia Pacific region, from Pakistan, and 1 from Bangladesh in Cox's Bazar. We're going to hear from each of them for about 7 or 8 minutes, and then go for some open question and answer and some discussion, and then leave you with some closing remarks. So without further ado, I just want to introduce the topic. We're going to dive right in and talk about GBV programming that promotes gender transformative change. So just want to say, why is this important? Well, first, the new strategic plan asks us to scale up access to high quality, gender transformative and survivor-centered services. So this is, something that's new in the strategic plan. It wasn't in the previous one. But I think, we don't, we've all seen sort of that scale that has, goes from like gender neutral to gender transformative. But what does that really mean when we talk about, our GBV programming? And, we really want to locate it in the fact that we know that GBV programming that promotes transformational change really is based on the understanding that gender inequality is a root cause of GBV. So with that in mind, we really want to, acknowledge that gender transformative approaches move beyond a gender sensitive approach that only seeks to respond to the different needs and constraints of individuals based on their sex, age, and disability. It also seeks it also seeks to eliminate gender neutral programming and address gender equality, gender stereotypes, structural discrimination, and exclusion of women and girls from spaces where they can interact and spaces where they can, voice their concerns and be part of their society. And so I'm just going to go through some of these main pieces here. A lot of this work can be found in, the work of our first speaker, these concepts, sorry, of our first speaker, Fulvia, in the gender transformative safe space work. So first, gender transformative approaches, they shift social expectations and behaviors and not just attitudes. So it's bigger than just the sort of social norm change of the individual. It goes from the individual, also goes across the socio-ecological model to address the interpersonal, the communities, and the systems. It catalyzes and reinforces new norms and behaviors that change rigid power imbalances that privilege men and boys. They recognize the importance of increasing women's agency and opportunities to challenge discriminatory gender norms. As I said, it shifts in unequal power relations across the socio-ecological model, and it really puts the survivor at the center. And I'm going to talk a little bit more about that in a second, because this programming, gender transformative programming, really needs to also build on the survivor-centered programming that we already do and we already strive to have. And it also widens women's spaces to act and engage with and transform the systems that maintain inequality. More about these concepts and more about these issues is in the GBV minimum standards, really speaking to standard 2 and standard 13, And it also really just starts with a strong gender analysis, because that's what you need to sort of address these issues. And many of the programs that we're going to speak about today do address some of these issues. It's very hard to address all of these, but I think that we need to sort of keep these in mind as we go ahead with the next SP. Next slide, please. As I said, we really also just need to be thinking that we're building on our survivor-centered GBV programming. But also remember that the survivor-centered programming is really also about empowerment. Our programming, is designed for women and girls. It is designed to be spaces where women and girls can thrive, to build their ability to influence communities and reach their full potential, free from violence. And here I've just put some very brief examples of, the empowerment aspects of, GBV services centered on women and girls, such as safe spaces are not only entry points for more specialized services, but have empowerment components, and many of them do address these negative social norms. And even the GBV subclusters and subsectors that UNFPA leads should be seen as forums for women's organizations to lead and influence the humanitarian response. Local women's organizations even co-lead some of these subsectors, and really it's a place for them to really, widen their influence, within the community. And also just we really need to leverage our ability and our position to listen to women and girls, to advocate that others listen to women and girls, and to leverage their voices and expand their role in response and sustainable services. Next slide. I want to wrap up and listen to our country presenters, but just also want to note that gender equality human rights and gender transformative approaches is considered the first of the 6 accelerators in our strategic plan, just to underscore the importance of this work and really thinking about it. And I really want to, see this conversation as sort of a, while there's been work done on this before, but just sort of a step to really sort of making this sort of substantive as we go forward. And these are just some questions to keep in mind, as we're listening to the presenters. And also, as we do our planning for next year and the following years. How can our programming sustain gender equality successes, gains, and transformational change? How can our GBV programming further promote and sustain transformational change, preserve gains and changes achieved? And what can we do to further enhance our gender transformative work as an enabler for the third zero? And just want to say our gender transformative approaches are not just for our GBV programming, but should be sort of across the board, focusing on our youth work and our SRH work, and of course our integrated SRH and GBV work as well. So these are just some questions to keep in mind. I don't want to go on for too long, so I want to hand over the floor to our first presenter, Fulvia Boniardi. She's a humanitarian GBV specialist in the Arab States Regional Office, and she's going to talk about gender transformative approaches within women and girls safe spaces.
Thank you. Thanks, Emily, and welcome everyone, and thanks for the opportunity to present Transcending Norms, which I actually have also here. This is a knowledge product that we have developed that looked into gender transformative approaches in women's and girls' safe spaces in humanitarian settings in the Arab states. And next slide, please. The objective of this publication of this knowledge product is to really bridge gaps that regarding safe spaces capacity to offer more targeted gender transformative approaches, in particular with the focus to those aspects of vocational trainings and empowerment activities that we provide within the women and girls safe spaces that often reiterate some kind of stereotyped or possibly also gender harmful norms. So we asked ourselves what needs to happen in a women and girls safe space in order to, and beyond, in order to provide different opportunities for women's empowerment and in the framework of vocational trainings in particular. Next, please. So this knowledge product is part of a larger knowledge series that the ASRO Humanitarian Hub is really focusing on to provide some support in order to improve the quality of our program in humanitarian settings. It was based on requests coming from women and girls themselves, and also from the UNFPA impact assessment that happens at regional level, and also from UNFPA staff themselves. And it's in line with global standards and was informed by focus group discussion and key informant interviews in 8 different countries across the Arab states in humanitarian settings. Next, please. I want to go directly into the main findings, which were 3 in particular. So the first finding was that women and girls safe spaces and safe space programming are gender transformative in itself. And this is because the safe space is a transformational space, as it is only for women and girls. This is what women and girls continuously tell us. It's a place where they have the opportunity to access information and access more specialized services, as we know, but it also provides an opportunity for building their skills through the vocational training. And what I found interesting is that women and girls tell us that they feel valued and empowered as persons, and not only as assets. That is something that they often feel within their households. And we noticed also that these changes in the individual level have also spillovers at family and community level, with a shift in power dynamics within the family, giving women greater autonomy, or having an impact in the treatment of girls and boys, children, or so changes in the treatment of female and male children, greater confidence and self-worth, and more trust in women in the community. However, the second finding says that the impact of the gender transformative approaches vary significantly among safe spaces due to various individual, interpersonal, and communal factors or barriers. So the main point here is that when offered the choice of activities, women and girls consistently select traditional activities, those that perpetuate these gender norms, like sewing, cooking, and the hairdressing that we all know about. And so, and this is linked to the fact that their selection options are somehow defined by several factors, most of which are externally driven, actually. So some individual barriers have to do with the prioritization. So the fact that many women in these communities are struggling to meet their basic needs, and so they may prioritize activities that can support their survival, their safety, their belonging, and the possibility to get a daily income. There are issues of agency. So the opportunities and the offer of different options do not foster sufficient aspiration to encourage then gender transformative choices. There are also interpersonal barriers where I think it's not new to us that the fact that husbands and other immediate and extended male family members limit women's and girls' activity options, even if they support them going to the women and girls safe spaces. And then there are more environmental and traditional barriers. Next. So the third finding is that enhancing the gender transformative potential of space-based programming requires intentional, sustained investment within the safe space, but also beyond the safe space itself. So looking at working with the families and the communities, especially main members, with the social norms changes and gender transformational work besides the safe space itself. Next, please. I've put here, Marina, if you can go to the next slide. Thank you. I've put here also some of the quotes, and because we always want to hear from them directly. So the second one, I find it interesting, where a woman was saying, there is a great need to educate families and society with non-traditional activities so that they are gradually accepted into society. The culture of shame is still very much present, where a woman cannot work as a mechanic, for example. So I think this speaks to some of the things that I've just mentioned as the finding. Next, please. The promising practices, I really recommend you to look at the document, but for example, I will just mention one or two. Enhancing the participation and empowerment through safe spaces committees. So, for example, having a committee of women and girls that strongly engages in decision making of what are the options, what are the opportunities, who runs the activities, how do we run the activity, where, etc. Or what I liked also is the creative promotion of safe spaces to the wider community through radio, through IFC material, through door-to-door work, many creativity that came out of the findings in the region. And to finish, I'll just go to the recommendations in the next slides. So one recommendations to those that are implementing safe space programming. First, strengthening the capacity of all staff on gender transformative approaches and the goals of these programming in women and girls safe spaces. And then women's and girls participation and empowerment. So to support women and girls towards this normalization of being different and looking for something different also within the safe space and with these vocational trainings, and raising awareness of women and girls on the options available to them, while also honoring their individual gender identities and also their having to live with within the larger community. And maybe just one more thing also, and I conclude because I'm conscious of time as well, on those funding these organizations to implement safe space programming, to recognize the critical role of women and girls safe spaces and to fund more flexible activities. It's in the next slide, more flexible activities and more flexible selection also of the activities that they want within the women and girls safe spaces. Thank you very much.
Thank you so much, Fulvia. There's a lot to think about, and I suggest that everyone on the call, if they have not already, to access the document. We'll put it in, oh, it is already in the chat, which is great. Take a look. There's some really interesting findings there, and it's a great piece of work that perhaps should be replicated in other regions as well. Next, I want to introduce Issa Sadou. He is representing Niger, and he is a gender and human rights specialist there. And he's going to be talking about the husband schools in Niger, which I think has been replicated elsewhere. And also helping with the presentation is Noemi Del Monte. Over to you both.
Hello to all of you. I can start?
Yes, go.
Please go ahead.
Hello, it's a pleasure for me to participate in this discussion, to exchange with you on the three approaches, or I will say strategies that UNFPA since Niger and in West and Central Africa developed in order to fight against gender inequalities and in general, and gender-based violence in particular. Before I begin, I would like to thank all of the B and the multilateral partners who are accompanying us in these different programs. In the pictures we see the husband school, the adolescent girl safe space, and the boys implication and traditional leaders. Slide. Next.
Marina, next slide, please.
Next slide, please. In this slide, I want to show you the three community approaches. The first approach is the husband school, which concern married men aged 25 and over, selected on the basis on 9 criteria, and who try to fight against inequality in terms of access to and the use of health services, and the fight against GBV, such as child marriage and the denial of opportunity for girls in terms of no enrollment in school. The second approach is in our language, Ilimi. Ilimi in Hausa means the knowledge. The second approach is implemented for in married adolescent girls aged 10 to 19 in safe space, who are at risk of early marriage and early pregnancy. We build their capacity to empower them in order to protect them from GBV. This approach has also implemented in times of humanitarian crisis. The third approach concerns boys aged 14 to 24 years, who are not married and who must adopt responsible behavior because they are the men of tomorrow. We strengthen their capacity to become responsible parents. Also, the main entry point of this approach is the traditional chieftains in Niger, which is one of the most stable socio-political institutions and has a certain legitimacy among the population. They are grouped in a single association. This makes it easy to work with them. Thus, community dialogue are organized under their leadership. Slide. I want to show you the result of husband school. And when we start husband school, 3 years to 4 years later, we noticed that the indicators started to increase. Here I give you an example for the assisted childbirth with or without husband school in the health district, as well as family planning. Even if the rates remain modest, this is the step forward in the highly Islamic context with erroneous interpretation of Islamic precepts. Slide. Next. It's the same I show you some example of the increase of indicator in the health districts with and without husband school, and the family planning of new client with or without husband school are increasing after 3 or 4 years later. Slide. Here, I want to show you what you call barometer. I think in English is the same barometer who show you the decision making in the family about what to say about the effect of husband-school intervention on gender dynamics. We conduct this evaluation with support of Georgetown University to show the effect of husband-school intervention to shift power with the couple regarding decision making. Next slide. Please, next slide.
Yes, I've heard you. It's just a little tech hiccup. I'm trying to change it, but please continue.
Okay, thank you. In this slide, I will show you in terms of outcome that in Niger, child marriage declined significantly between 26 and 2021. I must say that all these approaches are being replicated in the SWED project funded by World Bank with technical support for UNFPA in 9 countries, namely Burkina Faso, Benin, Cameroon, Chad, Cote d'Ivoire, Guinea, Mali, Mauritania, and Niger. And I show you in Niger by 2021, however, child marriage indicator will have declined significantly. Early marriage is still a drop of 11 percentage points between 2011 to 2021. Next slide. In this slide, I want to show you. I must mention that in the fight against gender equality, gender inequality, and gender-based violence, we really heavily have one of our main allies, which is the traditional chief, with whom we have just made a strong commitment to fight against child marriage and to promote an environment favorable to the capture of the demographic dividend. It should be noted that in West and Central Africa, we are in a synchronized and multi-stakeholder approach to reduce gender-based violence. I think that Naomi can have some details to my presentation. Thank you.
Thank you very much, Issa. Thank you. Okay, it's just only to share some, there was a slide in French. So this slide is showing this baseline that we have with the SWED in Western Central Africa. The project is across various countries. So Issa is the one who developed this approach in Niger, and the Swede allowed to scale up in the region. And most of our contacts are from conflict affected or very fragile. So now the next step for the Western Central Africa region is to think, also to look at what Fulvia just presented, to look at the GBV IR strategy and the UNFPA humanitarian strategy linking with the SP, and thinking about how we are going to scale up the approaches to link the GBV minimum standard 2, 13, and 8 to have this really transformative approach, because we have this amazing lesson learned for Sweden,
but we know where we need to improve. You probably noticed that the adolescent girl space is with a mentor. So this is an approach. They are underage, so it's good, but they are not yet empowered enough. And we don't have yet a structured approach for women and girls safe spaces. We have someone, we are women-led organization taking over the space, but in GBV subcluster, we don't have enough. So we have all this thinking that is starting now with the new SP and that we are looking forward to for the development. And thanks a lot for ISA to have developed all of that since more than 10 years, actually, because it was 2008 when he started the husband school in Niger. Over.
Thanks, Isa, and thanks, Noemi. A lot of great work that can be, where the lessons can be applied in other contexts. Over to Saliha Rame, who's a GBV program officer in Pakistan. She'll be discussing psychosocial support to GBV survivors in that context.
Thank you, Emily. Hello to everyone and a very warm greetings from Pakistan. In my presentation, actually, I'm going to share learnings from a model that we implemented in Pakistan, providing psychosocial support to survivors of GBV during COVID-19. And these learnings, I think, are becoming more and more relevant with this new variant at hand. And again, discussions around borders closure and lockdown being considered. As we all know that the COVID-19 led to global rise in GBV and Pakistan was not any different. The data from GBV helplines validated the manifold escalation of GBV cases as compared to pre-COVID situation. The increase in volume of GBV reporting had two streams. One, new cases linked to the lockdown strains, and two, intensification in continued violence that was being faced by GBV survivors even before the COVID-19 pandemic. But what COVID-19 did was that the vulnerabilities increased for both situations. Second slide, please. During the lockdown, the survivors found themselves in situations where violence was more extreme, and they could no longer escape by going to work or seeing friends or family. There were incidents where the survivors reported to the helpline that they are being threatened by the abusers, that if they kind of step out of the house, they would end up in the streets. And then what happened in Pakistan was that at the onset of COVID-19, the social services, including shelters, helplines, were declared non-essential services, and resources were diverted to deal with the health aspect of the outbreak. In this backdrop, UNFPA initiated intervention to build on the existing structures of government and leverage on the existing GBV clinical management and referral services, including helplines, and facilitated greater partnerships between civil society partners and government to ensure essential services, particularly psychosocial support and GBV referral, is available. Next slide, please. So UNFPA developed evidence-informed information material and communication materials and disseminated among local women's groups, women rights organizations, and activists, and asked them to advocate for the continuity of the GBV services, and also directly engaged with the government through targeted advocacy with the primary asks. And few of those I would like to share here. One was GBV-related service providers must be categorized as essential services to ensure continuity of services to GBV survivors. Women shelters should remain accessible to women in distress. Law enforcement agencies and administration-related SOPs must recognize that some women may be escaping dangerous and violent situations. They must respond to the complaints of GBV during COVID-19. GBV helplines and telepsychosocial support services should remain functional with upgrade capacity to respond to GBV survivors during COVID-19 pandemic. Healthcare providers should have the necessary skills and resources to deal with and respond to GBV cases during COVID-19 pandemic. Due to this combined advocacy, what happened was that women's groups issued different statements in Pakistan pressurizing government to make these services essential and ensure that they are operational and available for GBV survivors, to an extent that in one of the provinces, the women's group went to the court to challenge the decision of declaring these services as non-essential. So looking at the slide, you can see that this intervention involved different layers of intervention, but I'm going to focus on the training component of this model. Next, please. So UNFPA launched a capacity building intervention to enhance the capacity of its national partners, authorities, and civil society organizations to ensure that the response provided by the GBV services is responsive to the need of GBV survivors, including women, men, persons with disability, and other vulnerable groups. This turned out to be key for us in ensuring timely response at the onset of the pandemic and implementation of successful telepsychosocial support response for provision of psychosocial support with special focus on GBV. Since we all are aware that gender norms are embedded in the belief system, therefore the capacity building program integrated a principal module on self-awareness, recognizing own biases and prejudices, and also understanding our own experiences of discrimination and violence. This has been an instrumental component to engage on attitudinal change and social norms. We also at the same time recognize that addressing biases during service provision for GBV cannot be addressed with just one training. Therefore, the training was combined with a mentoring and debriefing sessions so as to ensure that follow-up support and guidance is available. This was done initially remotely due to the lockdown situation, but later hybrid modality where possibility of in-person meetings was possible, we kind of adapted that. And a partnership with telecommunication company was key to ensure that even during COVID-19, the helplines are operational and counselors are able to provide psychosocial support through their homes. The result was quite rewarding as we saw a quite change in the service provider in their recognition of the survivor-centered approach that we were discussing right at the start of the webinar, and also kind of understanding the urgency of sometimes in response, especially in domestic violence cases. So that was quite an evident change that we saw during the implementation of this model. To further kind of talk about the capacity building module, basically it is a set of different variety of exercises which gives participants an opportunity to understand and reflect on links between self-awareness, gender norms, and its impact on the response that's delivered to the survivor of violence. It also deepens participants' understanding on how to safely link GBV survivors with services upon their consent and willingness. So consent and willingness, the understanding around this is a very core of this training module. So currently, while we make incremental progress, we are working to institutionalize the capacity building component to address biases and discriminatory attitudes, because we kind of clearly understand that the scope and the extent of services that are needed cannot be replaced by civil society or the UN. So we need the government departments and institutions to come at par and be kind of sensitive enough to be able to provide those services to GBV survivors. We are also strengthening the module to ensure that the service providers are adequately skilled to support survivors with disability. The exercises in the module also bring forth personal experiences and the experiences from field, so as to kind of enhance the understanding of the participants on the different kind of multi-layered needs of the survivors, and also different challenges and dilemmas that are faced when you are on actually in reality providing support to a GBV survivor. And also, since we kind of belonging to the same community, have different kind of own experiences. So these modules also touch upon sensitive issues or around customary practices and religion. So therefore, advanced level of skills are needed for implementing the module itself. So going forward, what UNFPA Pakistan is going to do is also going to provide mentoring support to these government institutions in first 1 or 2 rollouts, so that it can be ensured that the content of the training is being delivered in its true spirit. So the initiative that's designed in a way where we not only kind of try to address the attitudes and social norms of the service providers, but the awareness raising component also touched upon the thinking process that might go into the thinking of a survivor itself. So our awareness raising materials kind of challenged some of the social norms and kind of gave a thinking process to a survivor to reach out for help, that it is okay to talk about the violence one is experiencing. So we feel that we try to cater to both demand and supply side through this intervention. Next slide, please.
Just 10 more seconds to wrap up, because I think we have to go to the next
So
speakers.
I'm almost done. This is just a kind of case study from one of the service providers who is the legal expert at one of the helplines, and reflections after the training. And yeah, so thank you so much. Over to you, Emily.
Thank you, Saliha. Over to Sophia Canovas, who's the GBV subsector coordinator in Bangladesh. And she's going to speak about implementation of Girl Shine and programs for adolescent girls, and highlighting the sort of the coordination aspects of it as well in her role. Thanks.
Thank you so much, Emily. Sorry, we have the light just left, but we have these internet issues in the field. But yeah, so what I wanted to say is that, as you know, Cox's Bazar is the biggest refugee camp. So we are here to serve the Rohingya community under the ISCG structure. The GBV subsector is led by UNFPA, and we work along the protection sector and also very closely with child protection subsector. So basically, this is the initial context that I wanted to talk about the high rate of GBV, particularly intimate partner violence. 90% are female survivors, but through GBV IMS, we also get data on rape and child and forced marriage. Next. Yes, so here I wanted to talk about the GBV subsector, the structure. So I'll put actually a link in the chat box if you want to see where are we placed. But basically, under this humanitarian structure with sector coordinators and working groups, we guide and coordinate over 50 GBV partners under the GBV subsector, which UNFPA is the biggest piece of the cake. And we work with the protection sector to ensure that vertical coordination and horizontal coordination is ensured, so that we work holistically, and that we also work through the field coordinators in the ground, so that we also ensure that we get the data for evidence-based informed programming based on what we are receiving from the field and the challenges. So we have a very strong intersectoral coordination with other sectors. And as I say, we also work with WASH, the Youth Working Group, JIHA, Dignity With Working Group, among others, to promote gender transformative approaches to transform discriminatory social and gender norms and to end harmful practices. Next. So here I'm very happy to say that today, a few hours ago, I was just presenting the strategy for 2022. Among others, I talk specifically about the importance of GBV prevention using evidence-based social and behavioral change or community-based approaches. And I specifically mentioned Girl Shine, but also SASA together to promote women's protection and empowerment. And the role of the GBV subsector here is actually to promote the rollout of standardized tested models, such as the Girl Shine, to make sure that we are tailoring to the context of the Cox's Bazar, the cultural and conservative context that we are facing here with the Rohingya community, and to make sure that they know their rights also to be able to exercise them and to access to SRH and GBV information and services. So basically, from awareness to accountability, we are working in a collective manner with all sectors to mainstream GBV, and also to make sure that finally the right holders know, fulfill, and they own their rights, so that they are actually accessing to what we have here, which is this GBV SRH integrated approaches in basically our women-friendly spaces that are led by UNFPA, having 22 in the camps. Next. So basically, UNFPA is the big partner. The implementing partner is DCA, but we have other 3 partners under the GBV subsector: Relief International, BRAC, and we are all working to make sure that we are following the standardized model of the Girl Shine life skill, so that through this participation of adolescent girls, we're actually designing our interventions in humanitarian settings. But also the aim is to ensure that adolescent girls have some information that is age appropriate and gender sensitive, and so that they actually are the ones as right holders that are protected from GBV, and that they are free from access to SRH and GBV integrated approaches. So basically, Girl Shine here contains 16 life skill sessions for adolescent girls to strengthen their social and emotional learning skills, and provides them with information related to adolescent sexual reproductive health and rights, gender equality, and effective communication. And then the most important, or no, equally important, is that there are also 10 sessions for caregivers, which are female caregivers, but also male caregivers, so fathers, to take care about adolescent girls, stress management, and GBV. Next. So here I will not go through all the achievements, but I think that for in terms of value for money and impact, is important to see that through these 3 implementing partners, coordinated through the UNFPA-led GBV subsector and also the youth working group that is co-led by UNFPA too, we are actually reaching 27 camps out of 34 camps. And we arrived to this solution after a rationalization exercise to make sure that we are not overlapping with the Girl Shine. And actually the results with these partners is like since 2018 that we started with this model, 3,042 girls graduated on Girl Shine curriculum, 1,276 male and female caregivers completed their curriculum with 10 sessions, and fathers are increasing enrollment, so this is good. And then 1,160 adolescent girls got their graduation kits that was distributed, and that actually it helps them to make sure that they are making their own informed decisions also about their futures. And finally, I would like to say that this Girl Shine also includes our focus on youth mentors and putting youth at the center of the response to as agents of change, and case workers, because are the ones that actually are having contact with the GBV survivors. So to make sure that they actually know with this gender responsive approach how to treat survivors. Then we have TOTs and refresher trainings on life skills, and this includes trainings on GBP, SCA, and caregiver curriculum. And this is also contains different communications modalities, video clips, and adolescent-led advocacy campaigns with youth-friendly language. And then finally, we are translating and contextualizing and adapting this to the Rohingya community, because most of them actually are illiterate, so everything is oral, so it's very important that we have this translation. And then community engagement activities are very important because actually it's the way to go, actually through the community engagement to transform social norms. And yeah, next. So I just wanted to show what are the results of the girls and boys after these sessions. If they think that they should be supported to attend a school, the opinion by caregivers before it was what you see here, strongly agree 35%, but finally we got the numbers with strongly agree, sorry, I cannot see, 51%. And so I think that agree is 45% and agree is 36%, but the disagree after it just like the 2%. So this is the most important to show about impact. And next, so in terms of the ones that they have actually gone through the life skill sessions on Girl Shine, we can see that before the feeling of safety, it was very safe 15, unsafe 51, and safe 27, while now we see unsafe 12, safe 53, and very safe 33. So we really see a lot of impact about these interventions, but also we're able now to actually track the progress on social behavioral change and how the right holders are feeling safer and getting more informed about what are the services that they need to reach. And also the caregivers are more responsible, and with the good diligence of a good father, they are aware of their responsibilities towards GBV for
Sophia, 10 seconds to wrap up, please.
Yes, so next. So basically, after implementation of Girl Shine skills, you can see here the Girl Shine participants, their caregivers. Through the Girl Shine curriculum, they become peer mentors. So we're expanding actually mentors through this Girl Shine curriculum, and then they are helping the community on GBV related issues and risk mitigation too. Next, but basically this is it. This is just some quotes from Girl Shine participants that we think that is also always good to hear or read the voices from the ground. Yeah, this is it. Thank you very much.
We can leave that up. Thank you. Thank you so much, Sophia. Okay, we have 3 minutes left, but I hope that everyone can go over by a few minutes because I want anyone who wants to speak. I see an action point from Christine Appio in the chat. Girl Shine approach is an amazing curriculum developed by the IRC. It's worth scaling up. Agree. And then there's a few questions for Isa and a lot of interest in hearing more about that and space for replicating that. For Isa or Noemi, just, a little bit more, I think there was a question about the curriculum. Any other questions that people, you can unmute yourself and ask? Or related, or focusing on, I think there was also a question or an observation on the gender transformative approaches and the strategic plan. Just to reiterate that it's mentioned twice in the SP. In two contexts. In the GBV section, I think it's paragraph 78, focusing on scaling up gender transformative approaches. And then also as an accelerator, not just for GBV, but across the 3 zeros. And it's the first of the 6 accelerators. Any other questions, or we'll go to Isa if there's no other questions at this time. Just unmute yourself and speak. You don't need to raise your hand. Okay, we'll go to Isa to speak a little bit more about I think the question, I don't see it here. Oh, it's in the Q&A. Is a little bit more on the curriculum and ensuring engagement of the husbands enrolled in the schools and how it reinforces, yes, this was my question as well, how it reinforces accountability to women. How do they influence the program and where's the accountability line? Good question.
Because I can see that Isa is typing. Isa,
Oui.
voilà. Est-ce que tu peux répondre à cette question, surtout celle sur la redevabilité vis-à-vis des femmes?
Je suis désolé, mais vraiment, je ne peux pas répondre comme je vais en anglais.
Okay, so Isa is saying that he prefers to write in the chat because he has more time to think of what he's writing in English, because it's difficult for him to respond to the same complexity of this question. So we can definitely follow up, that's for sure. I don't know enough the detail of safe spaces. I know how they work here in Burkina because I already visited them, but it's a couple of years that I've been traveling, very few, so I don't want to explain something which is old. So Isa can write in the chat about that. So there will be an answer in the chat.
Naomi, j'essaie de traduire quelques éléments. Hein?
Oui, vas-y. Tu peux écrire là où Christine a écrit. Tu peux mettre answer là, type answer, comme ça, elle a des éléments sur ça. En fait, elle veut savoir comment les filles, c'est elle qui prend la relève, en fait. Over. Toi, Amélie.
Je ne sais pas si je peux répondre brièvement. Tu peux traduire?
Oui, vas-y, alors.
Si c'est les filles qui répondent.
Oui, how do you ensure engagement with husband and role in the school reinforce accountability to women?
Oui, les maris, en fait, c'est des maris qui sont choisis sur la base des critères de leaders et puis des gens qui sont favorables à l'émancipation des femmes.
Okay, so when they engage the husband and the future husband, they decide with the leader, so it's deciding among men, but it's decided among men who are champion for equality, so who want to change the rules in the society. So that's the way that they still engage with the male community, but this way it's like people who are potential to be to have success in the husband school and the future husband school. Okay.
Okay, I think that, you know, obviously there's a lot of interest in having more conversation on the husband schools, both in English and in French. So I see Robert from Nigeria. Robert, thank you for your comment and question. I know causality is very difficult, but you know, to what extent is the reduction of fertility in Niger, which had the highest fertility rate in the world, I don't know if it still does, the result of strong pro-family planning position taken by the former president of Niger using Islamic arguments. I think that's really relevant due to, you know, the sort of ingrained traditional chief structure there, which is considered, you know, the most stable of, and, you know, it's a political institution in itself. So that's an interesting question, which we might not get to here. Any other questions? I know we're past time, and I, you know, really just want to frame this as, you know, the first of many conversations on this. Also would like to hear from anyone at UNFPA on this webinar, either by email or otherwise. You know, what else do we want and what else is needed on these approaches? You know, what kind of a knowledge product would we need to really take this forward so that, you know, we can really say, I feel like I'm hearing a lot, you know, these gender transformative approaches, they happen in development contexts. Obviously, it's not safe to do, you know, all sorts of work like this in humanitarian contexts. But at the same time, you know, we really can't limit this to development contexts, and we can say that we can do them safely in emergencies as well, which I think, you know, these discussions, you know, have contributed to. But yeah, just please communicate with me or anyone else of the panelists to see sort of what else we need on this, what will benefit you in your work going forward, you know, in the next SP that really sort of explicitly calls for this. I'll give a last call for questions, even though we're at time. Anyone else at this point? Okay. I know everyone else, this is such a busy time. Thank you so much for taking the time to come today for this discussion. And thank you to all the panelists for sharing their work. This was a really good discussion, and it's great to hear from, so many folks in the field and, the challenges that they encounter and the ways that they can address these challenges even through the gender transformative work. So thank you so much and have a great rest of your day. And of course, please stay in touch on these issues. Thank you so much.